Hi everyone, welcome back to my YouTube channel. In today's video, I will be sharing with you information on the CMS final rule for fiscal year 2024 Inpatient Rehabilitation Facility Prospective Payment System. Let's get started. On July 27, 2023, the Centers for Medicare and Medicaid Services, or CMS, issued a final rule to update Medicare payment policies and rates under the Inpatient Rehabilitation Facility, or IRF Prospective Payment System, and the IRF Quality Reporting Program for fiscal year 2024. CMS is publishing this final rule in accordance with the legal requirements to update Medicare payment policies for IRFs or inpatient rehabilitation facilities on an annual basis. Updates to the fiscal year 2024 IRF PPS payment policies. For fiscal year 2024, CMS is updating the IRF PPS payment rates by 3.4% based on an IRF market basket update of 3.6% reduced by a 0.2 percentage point productivity adjustment. In addition, the final rule contains an adjustment to the outlier threshold to maintain outlier payments at 3% of total payments. CMS estimates that this adjustment results in a 0.6 percentage point increase in outlier payments. CMS estimates that overall IRF payments for fiscal year 2024 will increase by 4% or $355 million relative to payments in fiscal year 2023. Modification to the excluded unit regulation. CMS is finalizing its proposal to modify the regulations governing excluded hospital units to allow hospitals to open a new IRF unit and begin being paid under the IRF Prospective Payment System at any time during the cost reporting period. In order to make this change, hospitals must notify the CMS regional office and the Medicare administrative contractor in writing at least 30 days before the date of the change and maintain the information needed to accurately determine the costs attributable to the IRF unit. Such a change would also remain in effect for the rest of the cost reporting period. An identical proposal to modify the excluded hospital unit regulation, which pertains to both IRF and IPF units, was also proposed in the fiscal year 2024 Inpatient Psychiatric Facility or IPF PPS proposed rule. The consolidated change to the regulation is being finalized in the IPF or Inpatient Psychiatric Facility PPS final rule. CMS believes this will alleviate unnecessary burden and administrative complexity placed upon hospitals and increase access to care. Rebase and revise the IRF market basket. Approximately every 4 years, CMS rebases and revises the IRF market basket used to update IRF PPS payments to reflect more recent data on IRF cost structures. CMS last rebased and revised the IRF market basket in the fiscal year 2020 IRF PPS rule, where CMS adopted a 2016 based IRF market basket. For fiscal year 2024, CMS will adopt a 2021 based IRF market basket and include changes to the market basket cost weights, price proxies, and labor related share. Updates to the IRF Quality Reporting Program. The IRF Quality Reporting Program, or QRP, is a pay-for-reporting program. IRFs that do not meet reporting requirements are subject to a 2 percentage point deduction in their annual increase factor. In the fiscal year 2024 IRF PPS final rule, CMS will adopt the Discharge Function Score or DC function measure beginning with the fiscal year 2025 Quality Reporting Program. This measure assesses functional status by assessing the percentage of IRF patients who meet or exceed an expected discharge function score, and uses mobility and self-care items already collected on the IRF Patient Assessment Instrument or IRF PI. The adoption of this measure replaces the application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan or application of functional assessment/care plan measure. CMS has also finalized a policy to publicly report data associated with this measure. Adopt the COVID-19 vaccine. Percent of patients/residents who are up to date patient/resident COVID-19 vaccine measure beginning with the fiscal year 2026 IRF Quality Reporting Program. The measure reports the percentage of stays in which patients in an IRF are up to date with recommended COVID-19 vaccinations in accordance with the Centers for Disease Control and Prevention's most recent guidance. Data will be collected using a new standardized item on the IRF PI. CMS has also finalized a policy to publicly report data associated with this measure. Modify the COVID-19 vaccination coverage among healthcare personnel or HCP COVID-19 vaccine measure beginning with the fiscal year 2025 IRF Quality Reporting Program. This measure tracks the percentage of healthcare personnel or HCP in IRFs who are considered up to date with recommended COVID-19 vaccination in accordance with the CDC's most recent guidance. The prior version of this measure reported only on whether healthcare personnel had received the primary vaccination series for COVID-19, while the final modification of this measure requires IRFs to report the cumulative number of healthcare personnel who are up to date with recommended COVID-19 vaccinations in accordance with the CDC's most recent guidance. Remove three measures from the IRF Quality Reporting Program beginning with the fiscal year 2025 IRF Quality Reporting Program. The measures CMS is removing include: first, the application of functional assessment/care plan measure; second, the IRF functional outcome measure, change in self-care score for medical rehabilitation patients or change in self-care score measure; and the IRF functional outcome measure, change in mobility score for medical rehabilitation patients or change in mobility score measure. Begin the public reporting of the transfer of health or TOH information to the provider post-acute care measure and the transfer of health information to the patient PSE measure beginning with the September 2024 Care Compare Refresh or as soon as possible. These measures report the percentage of patient stays with a discharge assessment indicating that a current reconciled medication list was provided to the subsequent provider or to patients or their families or caregivers at discharge or transfer. In response to the COVID-19 public health emergency, CMS initially delayed the compliance date for the collection and reporting of these two measures in the IRF Quality Reporting Program, and data collection began on these measures with patients discharged on or after October 1, 2022. This is it for today. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel. Hope to see you next time. Bye now.